time, so I do apologize, but I'm really excited to be here to talk with you guys about it. Kevin, is it okay if I share my screen by chance?
Yes, let me make you the co-host, and then you can do whatever you need.
Perfect. Yay, okay, perfect. It let me in. Okay. So I always just like to give people visuals because I'm a very visual person. And so I feel like it's just nice to see something on a screen rather than just me talking. But basically, what the Circle of Care is, essentially with our program, what we're wanting to do in our 1 year that we're here is build this network of support for children, youth, and families who are experiencing grief and loss related to substance use related death and disorders. So our program is created in partnership with the Illinois Family Resource Center. They're another statewide grant funded project. It's actually because of the wonderful work that the coordinator of that project, Nancy Phillips, has been able to do in the field that has kind of shined a light on the amount of children who are falling through the cracks of the traditional support systems that we have set in place. So she was able to shed that light on that gap, and that's kind of how we got funded for our project. And so I always like to just tell people too, that way it just kind of puts into perspective to them where we're located at. Even though we're a statewide project, we are located in Charleston, Illinois. So our lead agency is the Our House, which is a substance use disorder treatment facility. So they hold both the grant for the Illinois Family Resource Center and the Circle of Care. Um, so kind of like I said, we're a 1 year statewide grant funded project. We're funded through the Illinois Department of Human Services, Division of Substance Use Prevention and Recovery. But we were able to get some funds specifically from the American Rescue Plan Act that allowed for us to do this project, which is another reason why it's only 1 year. So people always tell me, they're like, Ambrosia, oh my gosh, what is going to happen after this 1 year of funding? And so I always like to tell people we do have sustainability plans. We have a plan. So essentially, what we're looking at is, again, the Circle of Care falls underneath the umbrella of the Illinois Family Resource Center. So after a year of funding is up, the Illinois Family Resource Center is just going to basically keep whatever we have going. All of the wonderful resources and materials that we're creating, it's all going to be housed on their website, and they're going to do the upkeep that's associated with that. So, if there's anything that you guys can take away from the Circle of Care, everything that we're going to talk about today, it's two things, and these two things right here. One, we're building this network of grief and substance use disorder resources for our children, teens, and families who are experiencing grief and loss related to substance use. But also, we're wanting to train as many of our natural helpers that we have in communities throughout the whole state of Illinois. And so, what I mean by natural helpers are people that are naturally interacting with children within their everyday professional as well as personal lives. So that could be like educators, that could be people that work at the local YMCA's, that could be, pastors or people who are seeing children at the youth groups every Wednesday night, or local coaches. Healthcare, first responders, anyone that has any type of interaction with children. We're wanting to train them on how to respond confidently and comfortably to child's grief that they may be experiencing related to substance use. So whether that's related to, losing a parent, caregiver, or loved one due to a drug overdose, or that ambiguous loss that kiddos may experience where they haven't lost their parent or caregiver due to substances, but that parent or caregiver or loved one just isn't there physically, or emotionally. So that's kind of like that ambiguous loss. And so with our project, we have technically 4.5 components that we're going to be doing in this 1 year, which I'll go into detail on all of those. The first thing that we're doing is we are creating a grief support services directory. So in our directory, it's going to be a very comprehensive online directory of the current clinical and non-clinical grief supports, resources, and services that we have in the state of Illinois, as well as some national resources. So we have a researcher on our team, and we've tasked her with doing 2 phases of research
She's
for
here.
us. Oh, sorry. The
She's
first phase.
here. She's here.
Whoopsies. Okay, we're good. The first phase of research that we've tasked her with doing is looking at in the state of Illinois, how many licensed clinical professionals do we have that advertise they're specializing in treating child and youth grief. And so she's already wrapped up phase one of her research for us, which I'll get into in just a second. But also, the second phase of our research, what she's been tasked with doing, is looking at the number of non clinical grief resources and supports that we have in the state of Illinois. So, who in our community, such as faith based organizations or hospitals, are hosting grief support groups for children or families? Maybe if there are any bereavement camps. I know up in like the Chicagoland area, and then some in the counties right below them have a lot of bereavement camps that they do for kiddos or grief camps. So, looking at those non clinical grief resources, we really want to be able to make this directory very comprehensive, very robust of all of the different grief resources, services, and supports that are out there in the state of Illinois. So our grief support services directory, as well as all of our other resources that we're creating, will be housed on the Illinois Family Resource Center website. So it's called IllinoisFamilyResources.org. I always tell people make sure you leave off the center, Illinois Family Resource Center, because there's two Illinois Family Resource Centers in the state of Illinois, we found out. So our website is IllinoisFamilyResources.org. So we do have the first part of our directory up. So the clinical grief professionals, we do have that up on our website. And we're looking at having our non-clinical, and basically the directory will be finished by the beginning of January. One other, just kind of based on our first data analysis that I like to throw out there to people is, looking at our clinical grief professionals that we have in the state of Illinois, we were able to find that throughout the whole state, we only have 243 clinical providers that are advertising they specialize in treating child and youth grief. And we were able to break this up based on region. And so with the Circle of Care, we go by the IDHS super regional map that breaks the state up into 5 different regions. And so you guys are located in, are you guys, I know that Lisa's Macoupin, Montgomery, right? Counties? Okay, so you guys are across Region 4. And so Region 4 was actually the region that we found the least amount of licensed clinical providers across the 22 counties. So you can kind of see here, Region 1 is specifically Cook County. Region 2 is the counties right below them. Region 3 is like, I want to say like Champaign County, Vermilion, like everything above there. Region 4 is the 28 counties, Springfield, Sangamon across. Region 5 is our very bottom of the state. So across Region 4, we were able to find that we have 17 licensed clinical providers who are advertising they specialize in treating child and youth grief. 17. And 14 of those are specifically in Sangamon County. So that means the other three or four licensed clinical providers who are providing grief support services. They're across all of our 27 other counties. They're like one in each of the other 3 counties. So it's pretty crazy. We were able to see there's a huge gap in service. I always like to throw in there for people as well. Basically, what we distinguish as a clinical grief provider is we were able to find these licensed professionals by looking up their specific licensure. So whether they were LCPCs, LCSWs, we were looking at billing codes. So if they were billing for grief specific services, as well as what evidence-based practice that they were providing. So I just like to throw that out there so I can show people some of the research we've done specifically in the state of Illinois. And so again, that's our grief support services directory. You can find it on the IllinoisFamilyResources.org website. Kind of the second part of our wonderful project is we're going to be developing some online resource toolkits. So these are going to be based on the developmental age of the child. So they're going to be in like 3 different groups: 0 to 5, 6 to 12, 13 to 17/18. And so inside of these toolkits, there's going to be a ton of different resources for our natural helpers to use if they come across a child that they've identified as experiencing grief related to substance use. And so some of the items that we are going to have in these toolkits, which those our first round of materials in our toolkits are actually going live at the end of this month. But we're planning on having in there activities for them to do with the kiddo, like worksheets that they can print off or games that they can do with them, educational videos for not only the natural helper, but also the child. And we've even thought about throwing in some peer-reviewed articles in there for our natural helpers to read on if they're really trying to understand, that connection between substance use disorder grief and the impact it has on the child. And so, just down at the bottom here, I wanted to throw in there that these toolkits are applicable. We want them to be applicable to all of these different sectors that we've identified as naturally interacting with children in some way. Um, so yeah, that's our toolkits. I also tell people all the time, I'm like, man, Ambrosia, people are probably wondering why you're saying, oh, we're going to do this, we're going to do that. I always like to just be very transparent with people. We were awarded this grant on July 1st. We had all of our staff hired by July 15th, and we've been hitting the ground running since then. Very much, it feels like developing and implementing at the same time. And so we're hoping to have all of a good majority of our resources completely developed by the end of January. So by the end of January, everyone should be able to have access and see our whole directory that we have, as well as these online resource toolkits will be completed. So kind of the third component to our project is our grief and substance use disorder specific trainings. So we have a wonderful consultant out of California. Her name is Jessica Porte. She has been in the grief field for the past 14 years. And she does have a lot of specialization that she's done in grief specific to substance use disorder. So she's worked with a hospice agency. She's on the National Alliance for Children's Grief. She is also a wonderful consultant for so many other people, and she does a lot of bereavement camps out in Hawaii with kiddos. So she's very well versed in the grief and substance use disorder realm, and so we're super excited that we have her on our team to be able to do this training for us. And so with these trainings, what our goal is we want to be able to provide educational components for our attendees as well as experiential components. So we're not only wanting to educate our attendees on what is substance use disorder, what is mental health, what does grief look like, what do the family dynamics look like of a child living in a home where substance use is present, what does stigma look like, and how does all of this impact the child. We also recognize with our trainings, we're wanting again to bring all of our natural helpers here that come from various sectors. So, healthcare and first responders, people that work at the local YMCAs, we're wanting our substance use disorder treatment professionals to come. We're wanting everyone in a community to come. We recognize that people have various knowledge, background, and experiences. So, that's why we're wanting to be able to provide everyone with the base knowledge on what these components are and how they impact the child. And then the rest of our training, really what we're focusing on is that experiential component. So being able to teach our attendees tools and strategies that they can use if they have a child that is experiencing grief related to substance use and how they can respond confidently and comfortably to that child. Um, so with our trainings, and I'll be sure to send you a flyer too, Kevin, that you can send out to everyone. But with our trainings, we're doing 5 in total. They're completely free, completely virtual. They're 2 days each, and they are from 9 a.m. to 3 p.m., I do believe. And so with the trainings, we have applied to offer CEUs for the trainings through the Illinois Certification Board. We're trying to get some law enforcement and educator CEUs as well. Um, yeah, we're really trying there. We're really trying. So yeah, we're trying to be able to offer CEUs for people to attend because we recognize that 12 hours between 2 days, that's a lot for people. And so we're really wanting to get those CEUs. I always like to tell people as well with the trainings, we made them regional. So based on the IDHS super regional map, which you can see to the right hand side, we made them regional because we wanted to build in opportunities for collaboration and networking between our various sectors, as well as our people that, in these regions, for them to be able to recognize and see the other resources and services that are around them and who all is interacting potentially with the children that they are serving. And so I also like to throw out there to people that I think your guys' training is March 6th and 7th. Say if you aren't able to attend that training, Perfectly fine. You can attend any of the other regional trainings. Again, we made them regional for opportunities for collaboration and networking, but we realized that this date may not work for everyone also. We also like to tell them too. Say if for Region 4's training you can attend March 6th but not March 7th, guess what? That is totally okay. You can attend March 6th of that training and then you can attend the second day of Region 5's training. Whatever works for you. We wanted to try to be as flexible as possible for people, just because we recognize people are very, very busy. So yeah, we do have registration live. Currently, we have 301 people registered across our 5 regions, which is wonderful. We're very, very happy with that. But we're wanting to train as many people in the state of Illinois that we can. Anyone is welcome to attend the trainings. And yeah, we have all of the live registration on that flyer that I'll send to Kevin. Um, Kind of our little half component to our program are our comfort bags for kids. So in our 1 year, we're giving out 14,400 comfort bags for kids, which is nuts. But we're super excited to be able to do it. So we are splitting up the bags by English and Spanish bags and youth and teen bags. And so in this picture right here, you can see these are our youth bags, our English and our Spanish ones. And so kind of what we're thinking for the comfort bags is during our Threads of Hope training, people that attend are going to learn the application of the materials in these bags. So that way, whenever they sit down with a child and they can go through the items in these bags and teach them how they can use these as tools to help them navigate whatever stressful or traumatic experience that they're going through. And so once people attend the Threads of Hope training, then we can send them some bags for them to give out to the kiddos that they serve. So in every single bag, we have our little Mimble balls, and I'll get my little guy out so I can show you guys him. I'll get my Cowan. But we have in every single bag this super cute Mimble ball. He's very cute. It's got crazy hair. We were able to work with the creator out of California, and she gave us a killer discount on the Mimble ball. So we're able to have one Mimble ball in every single bag, which is amazing. But the Mimble balls have a lot of meanings behind them. Your Mimble ball doesn't have a mouth because it means it doesn't judge you. It has this hair that whenever you're needing something comforting or tactile, you can give it a hug. And then your Mimble ball, if you bop it on the bottom, its hair goes crazy, and that's supposed to tell kids it's okay to be crazy in yourself sometimes. So we're really wanting to be able to teach people that attend the training how they can use all of these different items in the bags and how they can teach children how to use them. So again, in every bag we have a Mimble ball. We have wooden hearts with markers, which we're also going to be writing a comfort bag letter to the children. So that way, whenever they open the bags, they can see this letter. And say if a child, or say if a natural helper, like we recognize that, our educators, healthcare, first responders, everyone is busy and they may not be able to sit down and go through the items in the bag with the child. So we are writing a letter to the child. That way, they can like learn how to do that crafting activity with the heart in a way to express whatever feelings or emotions that they have. The rest of the bags have these bookmarks in them with Jerry Moe's The Seven Seas, and on the flip side, some teen helplines. And then the rest of the bags have a variation based on English, Spanish, teen, and youth. And so they have various books and journals, and they're all about social emotional learning for children. So yeah, and these are our teen bags. And then kind of the last component to our project is the Handle with Care initiative. So this was an initiative that was created to help vulnerable children through simple communication and partnerships between law enforcement and first responders, educators, as well as mental health providers if they are needed. And so this initiative started in West Virginia back in 2009. Since then, it's kind of trickled down into the state of Illinois through the Safe to Help website, as well as through our Drug Endangered Children Alliances. So this is not a new initiative. We're not reinventing the wheel here. We're just kind of jumping on the bandwagon and promoting it. Again, really what this initiative is about is say if we have little Timmy and he's at home and it's like 1 a.m. on a Wednesday morning, and say if mom and dad get into some type of domestic violence situation at home. and law enforcement get called out to the home. If a Handle with Care initiative is established in this community, basically what would happen is once that law enforcement officer would leave the scene, they would send some type of message to the educators at Little Timmy's school, whether that be a phone call, an email, a note the next morning, them just coming by that morning. And all that they would say is handle little Timmy with care. They wouldn't give any context to the potentially stressful or traumatic experience little Timmy went through the night before at home. Just handle little Timmy with care. If the community has this handle with care initiative established, the educators would then be trained and know that whenever little Timmy shows up to school the next day, and if he's falling asleep in class or acting out and having some behavioral problems, regardless of what it is, instead of them potentially reprimanding him for that behavior, they're going to provide little Timmy with whatever additional support it is he may need. So with this initiative, it's all about mitigating those negative effects for children who have experienced some type of trauma, and ultimately helping students succeed in school. So like I said, we're not reinventing the wheel here. We're jumping on the bandwagon. And so if anyone is interested in getting, a Handle with Care established in their community, they can reach out to us with the Circle of Care team. We would be thrilled to offer some type of training or technical assistance. We are finally in the process of finishing up this PowerPoint that we have, and we're actually looking at hiring a part-time law enforcement officer to help us in getting this initiative out into the community. So we're hoping that within the next month, we can get this going. So oh, whoopsies. I think that's all I have, Kevin. I'm sorry. Ambrosia talks a lot for those of you that know Ambrosia. I tried to get it all out though.
Um, Absolutely phenomenal, Ambrosia. That's you and I need to talk more about this because my kind of Chaz and I had talked about this. Chaz is one of our other our OGs of the mental health first responders. We had talked about this, looking at bringing mental health first responders more to emergency first responders as we go forward. And our social work conference in May, we're going to be opening that up to EMTs, police, fire, and we're going to be doing some specific um, work. What do I want to say? Presentations during the day of that workshop, geared more towards that. So phenomenal. And Kelly, I know you with NAMI do some with first responders as well. So would definitely want to pick both of your brains about this. Absolutely fabulous. Anybody have any questions for Ambrosia about the program? You gave us a ton of info, but it was all great.
Thanks. Yeah, and I will throw in there too. I think, and Elise, please tell me if I'm wrong, but I think that you guys were awarded the base or the cores, and one of your components is Handle with Care, correct?
Correct. So two parts to the base grant for us is one, expanding our prevention and education that we do in the schools already with our health educator, Bailey Moore. She's going to expand out to the Montgomery County area schools now too. But the second portion of that is the Handle with Care program. So right now, where we are in the stages of the Handle with Care is we have already reached out to all of Macoupin County superintendents and let them know that we want to get this started. And we've gotten some response back. So if I could ask for any favors on this call is to put a bug in your superintendent and your principal's ears that this is something that we can do. And so we're going to be working a little bit with Ambrosia on this and probably taking some of her trainings and getting some TA from her. But we have already started setting up a meeting for December where we're going to do a briefing. Lindsay can talk more on that, but we want to invite superintendents, principals, counselors, nurses, police departments, in to kind of do a briefing on what is Handle with Care, how are we going to do it, who wants to be a part of this, and then we're hoping by January 1st that we would have a Handle with Care program in every Macoupin County school. So if you guys have any more information, or if you want any more information on this, you can reach out to Lindsay or I or Ambrosia, because we work with ROSC and we work with Base, so we're going to have a lot of connection going on.
Yeah. Oh,
Ambrosia,
sorry.
I have a question. I got cut off. I apologize. So if you already said this, I apologize if I missed it. I have to sign back in. But do you have, I know I heard you have the, 2-day 12-hour training. Do you guys do anything that's like a condensed like hour training or anything? I work with, we have, you know, like 20 volunteers that obviously work a full-time job, but
Absolutely.
clearly in our, we service Jersey and Greene County, but the majority of our cases, there is substance abuse, trauma, and loss with our kids. So I didn't know if there was, if you guys had any condensed version that we could like get our volunteers to participate on, but with them having, most of them having full-time jobs, I can't ask them to get on 2 days.
Yeah, no, absolutely. And so we unfortunately do not have a condensed training, but with all of our trainings, we're going to record. I think our plan is to record all 5 of them, and then we're going to have all of those listed on our website so people can view them. And in terms of our sustainability, we would love for to somehow get it to the point where people can get like CEUs if they watch it virtually. I don't think we're at that point yet, but yes, we're going to be recording the trainings. And again, it's from 9 to 3, but that doesn't include, it's technically a 4.5 day each day, so 9-hour training instead of 12 if you include breaks. So whenever it's recorded, it will just be the 9 hours, 4.5 each day. So yeah, I know I hated that we aren't able to like condense it, or you know, one of the things that I wanted to look at in the very beginning whenever we had the project was being able to provide, you know, I know a lot with the work I used to do with the Ross Council, because I used to be a Ross coordinator in Edgar County, is going in and providing like specific trainings for agencies. But unfortunately, with our consultant being all the way out in California, this was the best way for us to get the trainings out there and available to people. So yes,
But
I'm
they'll be
sorry.
available on the website. Like if our volunteers could do it at their leisure and watch like an hour here. Okay, fantastic.
Absolutely, yes. And I wanted to throw out there too that I've been working with Keppen and also Amy with Birth to 5 in regards to like Circle of Care Handle with care stuff too. So you guys are all amazing. I want you guys all to know that you guys are all doing the work. So thank you guys.
Anybody got any further questions for Ambrosia? Ambrosia, if you've got time, hang with me after this because I do want to talk a few specifics with you. As many of you know, substance abuse, specifically alcohol, is very, very near and dear to my heart. I am a 5th-generation alcoholic myself, but the first in my family, first generation of my family to get sober and stay sober. I'm in my 21st year of sobriety, which brought me, thank you, not appreciate everyone, grace of God and my wife and her family, and also getting out of Chicago, that really helped. But this is near and dear to me because looking at my own story and looking at the stories of so many students I've worked with in 20 years as a school social worker, the earlier we get onto this, the better. I mean, I'm preaching to the choir, absolutely, but saying this, but recognizing now we have these actual programs, you know, and we started mental health first responders, Chaz, and we have this conversation all the time. People said, oh, well, there's no resources in this area. There's tons of resources in this area. People just don't know how to access them. Now we can get them. Now we can bring them to us. And when I present over the summers at our SEL conference, my presentation is largely about our schools are becoming our community centers, schools, community mental health centers, you know, public health departments and all of that, because the churches, and we don't have Knights of Columbus, and we don't have, you know, the Lions, we don't have a lot of stuff in the community anymore. So what's falling under, you know, our purveyance now. So that's why, you know, we built the link between the community and schools, and absolutely thrilled to hear about it. And want to keep it going. You want to have it in every Macoupin County school, we volunteer, come to us. Let's do it. Absolutely fabulous. Any further questions for Ambrosia, ladies and gentlemen? Much appreciated. Very cool. Keppen, I want to turn over to you then, and it's good to see you again. I think you were with the ROE when I first started down here 10 years ago, and happy to, I always say this, wait around a while, our paths are going to cross again, oftentimes in a different role. So want to turn over to you now and tell us about you and your agency, and you got some great resources for us. Thank you.
Yeah. Thank you, Kevin. Keppen Clanton, and I'm with Birth to 5 Illinois, Region 40. We cover Calhoun, Greene, Macoupin, and Jersey County. Birth to Five Illinois was developed out of the Early Childhood Commission report from the governor to look at all of our early childhood education and care programs. That doesn't just necessarily mean education as far as, it doesn't just include just education, it also includes the health part of it. And so this is our third year. We are here to look at what is available for our youngest generation and their caregivers and what is not available. And so we have been working to elevate our family voices in our communities as well as our provider voices. Whereas normally when policy and funding has come down, it's come down from top down. And as you well know, our legislators are telling us this is the money you're getting, this is how you're going to spend it, and this is how you have to spend it by. And so this is reversed from ground zero up, where our legislators want to hear from our families that are experiencing their experiences in early childhood education and care. They want to hear from our providers. There are 39 regional offices across the state. Like I said, we follow the ROE boundaries. In each office, there are 3 staff members. Myself, I'm a regional council manager. I have an administrative support assistant, and then I have a family and community engagement specialist. Our regions are the information that we have gathered are specific to our region. So the first year out, we created a regional needs assessment report, and we looked at all the education available in our region for early childhood programs, ages 0 to 5. And things that we found is at that time, we had over 5,000 children in our region that were ages 0 to 5, and we only had about 2,500 slots available for them in education as far as Head Start, pre-K, prevention initiatives, childcare providers. So we looked at what was the good, the bad, and the ugly. We talked to families about the good, the bad, and the ugly. And we came up with strengths and needs. And we make sure that one of the biggest thing is at the end of the day, numbers can be numbers and we can make them say what we want. But if we have the stories to tie the emotional support to it, then it makes it a little more powerful. So the best example I can give is if I'm talking to a legislator and I'm saying, hey, we're having trouble finding early intervention specialists or mental health specialists for ages 0 to 5. It's more power. Look, I can say, okay, we have 7 children that need early childhood intervention. And so that's a number. But here's a story that's a little more powerful that is happening in our region is last year we had a 3-year-old who was riding a bus for 90 minutes one way to get early intervention. So think of putting a 3-year-old on a bus one way to have to get early intervention. That's a little bit more powerful of a story to tell and towards our legislators, and it's not just about numbers. So we are constantly looking for those stories from our educators, from our providers, from our families of their interactions. The second year out, once we produced our regional needs assessment, we then came up with recommendations. And out of those recommendations, we created action plans with SMART goals. And then this year, we just recently completed our mental and behavioral health report for ages 0 to 5. As you said, Kevin, there are lots of resources, what we found in our region, but very few of those resources actually reach down to ages 0 to 5, or as Ambrosia says, or help cover those caregivers for those people. We have lots of grandparents raising grandchildren due to alcohol and substance abuse, and those grandparents need mental health resources as well. And so our goal this year is we're implementing the action plan. We'll be adding a mental and behavioral goal as well into our action plan that we'll be working on. So in the process of doing this, I attend a lot of interagency meetings, learn about new programs that are out there or ones that already exist. And that's how I ran into Ambrosia. This program is fairly new, but it's something I was a principal for 17 years. I did work at the ROE, ran their professional development program for 3 years. I don't even remember. I've just been in education for a really long time. But when I ran into Ambrosia and she explained her program, I was like, oh my gosh, we have needed this for a long, long time. Other programs I run into, I know, Elise, I think you're part of the head of that ROSC in Macoupin County. So I sit on the Macoupin County Council for ROSC as well as the Greene County one. And Jersey County is in the process of getting hopefully one set up soon. Through those programs, I've learned about a lot of different resources that I wish that we had known about even when I was a principal that I was not aware about. And of course, there's always new ones. Probably my biggest concern that I see right now is just to do a little comparison in the early childhood sector, there was all of these early childhood programs and it was like this huge web, and parents did not know where to go to, what they were eligible for, things like that. And so through the governor's commission, that's our goal, is to get it down. We now have a new Department of Early Childhood that's going to be stood up to streamline that. My concern right now is there is a lot of stuff being pushed out from the state for mental health and mental health resources. And I'm seeing the same thing starting to happen. Here's a resource, here's a resource, and so it's all becoming this big web. And if there's any way that I think, we need to figure out a way to streamline that. That's just my little opinion. But after sitting in these agency meetings, these are things that I'm seeing, and I'm like, oh boy, this can become very confusing for parents and caregivers to try and figure out, where do I go for help? And so I think as we have two councils. We have an action council that's stakeholders, and we have family councils, so that we're always hearing those family stories. And I believe probably one of our goals in our mental health plan is going to be to help streamline that information into one resource for our families. And so we haven't approved that goal yet, but I'm thinking down the road that is something we definitely are going to need. In the meantime, I did want to share with you some resources that we have or that I know about. I'm not sure, you may already know some of these, you may not know of some of these. And so Chaz, is there any way I can share my screen? Oh, here it is. Let me see if I can share it. Let me pull up my
co-host, Kevin, so you should be
okay.
able to,
thank you.
Yep, there you go. Perfect.
Okay, so like I said, we're birth to 5. I want to skip down here a little bit to this one if it'll let me. If you can see this, that's great. So it's some community partners that we've put together that we are partnering with. And what I wanted to do was kind of pull up these different websites so that you're able to see them and just quickly go through the process of what these actual websites look like. And I'll share this document with Chaz when the meeting's over, and he can share it out with you guys. Let me find my thing. Where did they go? Oh, I think that's it. Hang on. I'm not sure where it went. Oh, here it is. Okay. It's hard to see it. I'm sorry, guys. Let me pull this down.
Kevin, get it to Kevin
Okay.
if you can. He can send it out.
Okay, I will do that. Oh, I'm sorry. I didn't mean Chaz. I know I've seen you in a different place, Chaz. So I mean Kevin. So the first website I want to talk about is Spider. I don't know if you guys are familiar with Spider, but Spider is actually a web-based program that's been put out by DCFS. And I figure it's fairly easy to use. Our team has been training with Spider to make sure that all the resources in our region are going to be in there. As you know, we're creating a big Excel document that we're sending to them. And Spider, you can put in your search your location by zip code, and then it comes up with a small avatar for yourself. You can do different distances, but what's great in Spider is you can do this drop down: mental health treatment, substance use treatment, domestic violence, parenting, early child. You can click any of these. And then you can go by service type. So you can look up, like, if you just want to look up anger management, there you go. Counseling, therapy, payment type. It drops it down into Medicaid, Medicare, DCFS payment, private insurance, language. And then you just click a search. I don't know what's going to come up. So down here, then it will pull up all the available resources in the region. Or within that 50-mile region, and then you can click on them, and it will tell you their contact information. So that is a website that's put out by DCFS. Like I said, I don't know if you guys are familiar with it or not, but it is a wonderful resource that we discovered, and we'll be taking we're crosswalking our resource with the people who run Spiders. There's only 4 people that actually take care of this. This has been in existence since like 2008. Very few people even know about it. We did not know about it. We just happened to come across it. But we're going to be sending them our resources, and I think Region 3 will as well, to make sure that those resources are in there and you're able to hopefully find them and help them keep that updated. In addition, there's another one that's put out by DHS that's called Beacon. And you may be familiar with this one. Beacon is the mental health resource that is put out by DHS, and you can put in like what your child is as a parent or a guardian would create a login, and they can get some mental health access to some mental health resources. Hang on just a second. I don't know why this won't let me. I want to pull this down, but how can I get rid of this here? I want to, hang on. I'm trying to pull this down. Just a minute, guys. I want to pull this down. Okay. The next one is Greene County ROSC, and which Greene and Scott County Recovery Council. I also sit on that council, and so we are in the process of actually redoing our strategic plan a little bit. And but it's a great resource for our families that are experiencing addiction and recovery, just as the Macoupin County one does. We do similar things. And then there's Doc Assist. I don't know if you guys are familiar with Doc Assist, but Doc Assist is also put out by DHS, and it is a program for providers and also school-based health centers, private practices, schools, healthcare officials, school nurses, school counselors. And what this is a psychiatric consultation line. It's completely free. It's staffed by a child and adolescent psychiatrist. And they can provide your mental and behavioral health resources, substance abuse resources, trauma-informed care, medication and therapy best practices, assistance in locating referral services. So this is something that is fairly new as well, if you're not familiar with it, but it's a great resource for those counselors, nurses, doctors to be able to call to get more information on mental health and how things look like in your county. Macoupin County has the Healthy Families in Macoupin County. It's always been there. Just recently, it has a new director or supervisor for the program. And so they are looking for more. They have several slots open for families that are have young children, and they do home visiting. And so it's a great resource for our young moms, even our moms with new babies. The next one, I don't know if you guys have heard of Parent Able. Is this something? So this is a curriculum through ISB. It is free. This is a wonderful program. It goes back to the fact that a lot of times we parent as things were modeled to us. And so oftentimes the question in the school district is, how do we get our kids to be motivated? Or, sometimes we might think that parents aren't motivated to get their kids, they don't value education. And so then that leads down to maybe the next generation. Parent Able is about, it's a program that you can put into your healthcare classes. And it teaches children or teaches teenagers good parenting skills. And so you may think, well, what do you mean by that? So what they do at the beginning is they show these teenagers a scenario with a parent dealing with a child, and they ask for the teenagers to give them a reaction. How would they handle that interaction with that child? Oftentimes they're going to handle it the way that it was modeled for them. And if we don't take the initiative to show them maybe some different ways or better ways, then they're never going to know. They're just that's always going to be in their mind. So over a 10-week period, this curriculum is implemented. And then at the end, they re-show them the scenario and ask them, now, how would you parent? And the end results have been absolutely phenomenal of what we've seen, because they begin to realize, oh, wait a minute, maybe I need to parent this way, as I go on. But this is a free program. It's actually, if you're familiar with Matt Weld, and I believe LR03, he was the creator or as a co-creator of this program. And I believe it is free to ISB, through ISB. So if you need any information, you can reach out. I just Googled their Parent Teach Institute, and they sent me the information. about it. But if you need any more, please let me know. I can probably find some more for you. Let's see. The next one is, of course, is United Way 211. You're probably familiar with United 211. In our region, I always had trouble finding the information for us. Well, part of that reason why is because we are out of the St. Louis region. All 4 of our counties are out of the St. Louis region only. The rest of the state of Illinois is out of Chicago. And so recently I've been able to meet with Brittany Van Hosen, and she is focusing on our counties to get our county resources, our region resources into 211. So hopefully you're going to start seeing more of our resources there as well. And then I have, that's 211. And I think, just yesterday, I was at a meeting, and, there's a thing called 5th Street Renaissance, which is out of Springfield. They cover all of, they have like 44 counties south, so southern. So they're us as well. They do the community outreach and recovery support team. It was
Hello.
2 ladies who spoke.
No,
That's okay. And so what they work with is like transitional housing, youth service programs, HIV reintegration, life skills, housing advocacy, food and clothing. But they will come down to our region or to our area. In fact, they're basically been working out of Springfield area, but they want to come out into the rural areas. So I have that information. And then the last one that I just recently met up with was our SUPIC, our SUPIC, I guess. And so this is where I think some of the confusion comes in, because what I found is there are things like Ross councils. There's our SUPIC, which means the center, and then you have cores, and then you have our subsys, which is services. So you've got lots of things coming out of like DHS, like Ambrosia's program. And a lot of these are starting off as 1-year grants. So they're each covering different things, but yet I'm afraid that people are gonna be like, well, what program do I need to look into? So our SUPIC is another one that I just was with yesterday. They look at education, environmental practices, community-based processes, things like that. I've got to do a little bit more, but they are basically a substance use prevention integration center. So, and I think they're the ones that also provide the youth mental health first aid. So all that being said, like I said, I will send my information over to Kevin, and so that you guys can have at least these websites. But the big thing is we are trying to build a collaboration for early childhood education and care programs. We are working with, on our one council, we have nurse practitioners, we have mental health, infant, early child mental health consultants. We have 2 of them. We also have people, directors and teachers and home visitors on our program. And then on our family councils, we do not provide a direct service. Instead, our role is to bring these partners together and get this information out, and then also speak to our policymakers about what's happening here in our region. So when you look at our region's action plan, our region's action plan might look different from Region 1, which is north of us, because they have different needs than what we have. So we work with local, state, and federal policymakers for funding. And I think that's it. That was a lot in a little bit of time.
That was fantastic in a little bit of time. Thank you, Kevin, very much. Yeah, if you don't mind sharing your slide with me, and I will send that out so people can just click on the links in there. There's a ton of good stuff, and I think I had maybe heard of 2 of those. So absolutely phenomenal, and thank you for sharing, because armed with this stuff, I mean, it's the more info we have, the better we can serve everybody entrusted to us. I say all the time, we don't have the opportunity to say, I don't know what to tell you. Like, we are all the people that, you know, we get the questions and people are bringing stuff to, and they need us to, they very much need us to assist. So being armed with all of the info is absolutely invaluable. Much appreciated. Anybody questions for Kevin? Fantastic. Hearing none, I will send those out. And then again, people have questions or any requests for follow-up or anything like that, by all means, feel free to email that. Anything else for the good of the group today? Anybody else have questions, thoughts, anything? Hearing none, looks like our December meeting is going to be, we're not going to do Zoom. We're going to try for an in-person meeting, which we used to do regularly, have not done in the last couple of years, but our conference in October was such a roaring success. We're going to be in person at the Germania Coffee House in Jerseyville. Ryan Wamser from the ROE got us the location and all that. We're going to be there between 1 and 4 on December 19th, which is a Thursday. I understand that's right before Christmas. I wanted to do some collaboration. I know some of our school folks going into Christmas break, if people are wanting to problem solve around individual cases and stuff, by all means, we can do that. Have a little collaboration, network, share some resources, and definitely planning on having some Christmas cookies there. So bring some, or we'll provide some. Bring some, bring your favorites, whatever. But it'll be mixing work with pleasure. So sending that out, we'll put that in the chat as well. Jessica.
Oh, that was my question, Kevin. Can we receive that information with the timely notice to make sure that additional participants can get that approval?
Yes, absolutely, 100%. I'm glad you said that, Jessica, because my superintendent just said, hey, for this mental health thing, you need to start getting your sign in for going out to places. And okay, we'll do that. Yes, I will absolutely send that out in the email. Much appreciated. Thank you. Questions? Anything for the good of the group? Kevin and Ambrosia, absolutely fantastic. Thank you both. And thanks to everybody for being with us today. We had 27 on and off today, which is a high for us in 2024. So absolutely fantastic. And if you build it, they will come. Happy to have everybody here. Thank you all so much. And Amanda, lots of good stuff. Thanks. And thank you. Thanks to all of you. Much appreciated. We'll see everybody hopefully in December, and everybody enjoy your Thanksgiving. Thank you very much.
guys.
Bye, guys.
And I'm going to end our recording.